Morning, students. Let me check. Let me check. Is it working? Yes, I presume it is working now, and I'm audible also. Yes. So, a very good morning to all of you once again. So, today we'll be taking we'll be having a rapid fire questions on what we expect in recent advances. So this is a topic which is always has to be discussed, has to be we should be aware about what possible recent update has happened, so that if there is a possibility these questions come, so we are able to answer, right? So a very good morning, Shreya and others, those who have joined. Yeah, let's start. So, just to give you a small information that tomorrow also from 8:30 to 9:30 on Unacademy platform, I'm taking a special class on numerical based questions in community medicine, all those questions which have been asked in past. And I'm also starting a capsule course for NEET PG 2021 from 29th of November. And from 5th also, I am 5th December also having a revision course, right? Based on, so this is for your information, students. And let's start with the today's session. So let's start with the first question. Government of India under Poshan Abhiyan has fortified how many staple food students? So under this Poshan Abhiyan, GOI, Government of India has fortified how many staple foods? Is it 4? Is it 5? Is it 6? Is it 3? Try this. Shreya, Meena, Prachi. Under this Poshan Abhiyan, how many staple foods has been fortified? Okay, Meena goes with B. Anyone else? Prachi, 5. Okay, 5. Shreya, anyone? Okay, yes. So please remember, under Poshan Abhiyan and under the new nutrition component, Government of India has fortified 5 staple food students, right? Why staple foods are getting fortified? Because this is consumed on a regular basis. So when it is getting consumed on a regular basis, so if it is fortified with the micronutrients, definitely it helps us to decrease the deficiency of all those micronutrients, right? Okay, nowadays it is also important to, whenever any food is fortified, you will see this logo of plus F. So this plus F and with this half circle, this logo, if you see, it means it is a fortified food product. So it is blue plus F logo on the packet. So if you see this nowadays, so it indicates that the food is fortified. And this logo has been released by FSSAI, which is Food Safety and Standard Authority of India. Food Safety and Standard Authority of India, Government of India. So the micronutrient added are mentioned below the logo. So it will be mentioned which micronutrient is added below the logo. So this is an identification, this is a logo which will help you to identify whether the food has been fortified or not. Okay. Just see the, I'll just give you the staple foods, 5 staple foods. You see, this is wheat flour. So you see the logo plus F logo, and you see it is fortified with iron, folic acid, vitamin B12, right? You see rice, it is again fortified with iron, folic acid, vitamin B12. This is salt. Salt, we already know, iron, iodine. Oil, vitamin A and D. Milk, vitamin A and D. So this plus F logo is an indication that the food is fortified. and it will be written with what component it has been fortified. So iron, folic acid, vitamin B12, or iron and iodine, right? So this is important. You should know this. Okay. Let's move to the second question. Under Ayushman Bharat, you know all Ayushman Bharat is a program. So under Ayushman Bharat, Health and Wellness Center is expected to deliver how many services, students? Is it 10? Is it 11? Is it 13? Is it 12? Try this. Under Ayushman Bharat Health and Wellness Center, how many services you are expecting from Health and Wellness Center? Is it 10? Is it 11? Is it 13? Is it 12? Shreya, Meena, Prachi, anyone? How many services do you expect from Health and Wellness Center? Is it 10? Is it 11? Is it 13? Is it 12? Okay. Suppose if you are not aware, I'll just give you an example. So Ayushman Bharat has got two components. One is Health and Wellness Center and the second is PMJ, right? Pradhan Mantri Jan Arogya Yojana, and this is Health and Wellness Center. Shreya goes with 11. No, Shreya, it is not 11. It is not 11. It is 12. Please remember. So I was just explaining, Ayushman Bharat has got two components, Health and Wellness Center and PMJ, which is Pradhan Mantri Jan Arogya Yojana. Now this is basically insurance one, which you know 5 lakh rupees insurance per family which is there. Now this Health and Wellness Center is, what is the rationale behind this? What is this Health and Wellness Center? The government is envisaging to convert PHCs and sub-centers into Health and Wellness Center, so that this Health and Wellness Center delivers 12 services. I'll give you the name of 12 services. So you know all these 12 services, at least few you know. If I ask you what are the services which is extended through PHC, CHC, you say mother and child activities, family planning, communicable disease. So primarily it revolves around this. But now since the name is Health and Wellness Center, so it is also focusing on 12 services. And first of all, how do you remember these 12 services? It's very easy. Let's put it as RMNCHA, right? So it will take care of all RMNCH. See, pregnancy, childbirth, neonatal, infant, childhood, adolescent, family planning. So of the first 4, if you see, it falls under RMNCH. Not a problem. The first 4 it falls under RMNCH. 5th, you see, management of communicable disease and national health program. 6th is management of common communicable disease and OPD, normal OPD. So 5th and 6th also it's more or less fine. Now from 7th, you see, so first 4 is RMNCHA, 5th and 6th is communicable disease, 7th is NCD, 8th is eye and ENT problems, 9th is oral health, elderly and palliative health care, 10th emergency medical services and mental health. So if you see the 12 services, if you club it, it more or less look like a primary healthcare component which will be extended, which will be delivered through Health and Wellness Center. So it all makes into 12 services, students. Very common nowadays. Everyone is working on this. Let's transform the PHCs and sub-center into Health and Wellness Center, right? Because it is mandated that they will be delivering 12 services. How do you remember these 12 services? Very easy. First 4 is RMNCH, A. Next 2 is communicable disease, management and treatment and health programs related to that. Then comes NCD, eye, ENT, mental health, geriatrics, health, oral health, emergency. That makes into 12 services. Okay. Let's take the next question. National health policy. 2017 we had a new national health policy. Target by 2022. What is the target they have kept by 2022? Establish Delhi as a measure of burden in trend of disease, MMR to 100, increase life expectancy at birth to 70, and IMR to 28. Try this. Joseph, Prachi, Shreya. So what is National Health Policy target by 2022? Manju goes with C. Anyone else? National Health Policy target by 2022. Joseph, Prachi goes with A. Neha, Sumit goes with C. Nina goes with A. Yes. So now, please try to understand how you are going to read National Health Policy. It's important that National Health Policy came into existence in 2017, right? So, and it has kept targets at frequent intervals from 2017, 18, 19, 20, 22, and last is 2025. So it is, you may know this, but which one to accomplish till at what age, what is that year, that may confuse you. Is it MMR 100? Is it life expectancy at birth 70? It is IMR to 28, established Delhi as a measure of burden of disease. First of all, to this question, the answer is A, right? Let's establish Delhi, disability adjusted life years, as a measure of burden of disease or trend of disease. Why Delhi? Because you know Delhi measures both morbidity and mortality. So can we establish a Delhi system to measure the burden of disease? So this is by 2022. Now, the important is not that. The important is that by year I have to take 2017. 2017, if I take, the target is to eliminate Kala-Azar and filariasis. 2018, leprosy. So if somebody asks what was the target of NHP by 2017, so Kala-Azar, filariasis elimination. 2018, eliminate leprosy. 2019 was IMR 28. So let's bring IMR to 28. What is the IMR of as of now of India? It is 32 and the data is of 2018. So we'll see when 2019 data comes, what is the IMR. By 2020, what do you want? MMR 100, 90s to 90s, 90 for HIV AIDS, prevalence of tobacco by 50% reduction, Swachh Bharat Abhiyan, occupational injury reduction by 50%, and state health sector spending greater than 80%. So what is important here now to, whenever you are reading national health policy, so what are the targets to be accomplished till what year? That is important. So this was not the question. The question they asked you about 2022. So by 2022, we'll be establishing Delhi as a measure of burden of disease. And then the last part is 2025. You have life expectancy, TFR, under 5, and neonatal mortality rate, stillbirth, TB cure, prevalence, everything. So by year 17, 18, 19, 20, 22, and 2025. So if this way, if you underread, it becomes easy to comprehend and remember. Okay. Okay. Now, SDG is targeted towards reduction of under 5 mortality. What is the SDG target of reduction of under 5 mortality? Try this. Sai Prasant, Neha, Shreya, Nina, Sumit. What is the under 5 mortality target by SDG? Is it 25? Is it 30? Is it 35? Is it 20? Okay. Yeah, Shreya goes with A. Sai Prasad goes with D. No. Nina goes with A. Yes. So SDG is targeted towards reduction of under 5 mortality is 25 per 1000 live birth. Okay, the answer is this. Okay, now there are 17 goals, and the main important goal for us is good health and well-being, which is the third one. You know this. Now we have to remember the targets. If you remember, this was the question, direct question in NEET PG 2020. what is the SDG target to reduce maternal mortality? That was less than 70. So if you see, students, that MMR, you see how the target they have framed, and try to comprehend this in this way, it will become easy. So globally, the first important target which has been thought is maternal mortality ratio reduction. So what is the global target? Less than 70. From then come to neonatal mortality, under 5 mortality. Neonatal mortality to 12 per thousand, and under 5 mortality to 25 per thousand. So the first two targets, under which 3 indicators are there: maternal mortality ratio, neonatal mortality, and under 5 mortality. So 70, 12, 25. Once we are done with MCH component, primarily of mother and child mortality, then we come on communicable disease. Can we end the epidemic of AIDS, TB, malaria, NTD? NTD is neglected tropical disease, and let's start focusing on hepatitis, waterborne disease, and infectious disease. Once you are done with communicable disease, let's come to non-communicable disease. Can we reduce the premature mortality from NCD by 1/3? So, mother, child, communicable, non-communicable. And then we come to substance abuse, right? When we come to this substance abuse, prevention of substance abuse, then reduction of death from RTA, half by RTA, and then universal access to family planning, achieve universal health coverage, and reduce death due to air, water, and soil pollution. So these are the 9 important targets: mother, newborn, child. Two targets, 3 indicators: communicable disease, non-communicable disease, substance abuse, road traffic accident reduction, family planning, universal health coverage, and prevention of deaths from other causes like air, water, and soil pollution. So these are the most important 9 targets of SDG. If they have asked MMR in the last year, they may ask any other questions related to that. So it is important we learn this, right? Okay. In addition to that, they have also got additional targets, which is just for remembrance, no specific values in that. That let's strengthen the WHO FCTC, which is Framework Convention on Tobacco Control. So this, can we strengthen the tobacco control? Can we support research and development of vaccine and medicine? Right? Can we increase health financing, and can we increase the capacity of country to identify the health risk? So these are all generic things, important, but those things are more important than this. Okay. Okay. Let's take the next question. How do you proceed with a moderate COVID case who has tested positive? How do you proceed with a moderate COVID case who has tested positive? Shift to COVID care center, shift to dedicated COVID health center, shift to dedicated COVID hospital with ICU facility, send them to home. Try this. Joseph, Mahesh goes with A. Anyone else? Neha goes with A. No. No, Neha. No, Mahesh, it's not A. So, COVID is divided into mild, moderate, and severe. So, when a COVID is moderate, means SpO2 is less than 95. So, this moderate COVID cases, no, Mahesh, yeah, Shreya is right, Manju is right. It goes into dedicated COVID health center. Absolutely right. COVID care center is for mild asymptomatic cases, right? So it goes to COVID care center. Moderate case goes to dedicated COVID health center, and severe case definitely goes to dedicated COVID hospital with ICU facility. There is also provision of home isolation, but this home isolation is for only mild cases as decided by the treating physician, right? So the answer is dedicated COVID health center, not dedicated COVID hospital. Dedicated COVID hospital with ICU facility take care of severe COVID cases. Okay. Okay, let's take the next one. National Quality Assurance Standard, which is NQAS, has how many area of concern? 8, 4, 7, 9. Try this. National Quality Assurance Standard. Nowadays, everything is based on NQAS. National Quality Assurance Standard has got how many area of concern? So Shreya goes with 4, D, 9, Shreya goes with 8. Okay. Krish Tarun goes with C, 7. Okay. National Quality NQAS. Nowadays the quality is now given importance. So NQAS has got 8 area of concern. First of all, I'll show that, and it is to every facility, either district hospital, CHC, PHCs, urban PHC, should be, should abide the NQAS standard. And if then there is a certification, NQAS, the committee goes and try to assess whether it abides by that NQAS standard or not. And if it abides, it gives the certification. So there is a 8 area of concern in that. All those are, for example, service provision, patient's right, input, support services, clinical care, infection control, quality management, and outcome. So these are the 8 areas under which the facility is assessed whether they abide by the standard or not, as mentioned in NQAS, right? This NQAS is basically an Indian National Quality Assurance Standard, Indian, and its standards are based on ISQA. ISQA is International Society for Quality in Healthcare, right? So I'll just show you this. So area of concern, service provision, what service is extended, patient rights, inputs, how is the hospital with beds and other thing, support services, clinical care, infection control, how you're going to manage the quality and outcome. So under these areas, the facility is assessed as far as quality is concerned. So if you see how it happens, area of concern we have 8, standards, then you have to set certain standards, then you have to check certain measurable elements, and then you have to check the checkpoints. I'll just show you an example. Just see this. Let's take for example district hospital. So district hospital area of concern is same. It is bucketed under 8 headings, but the standards will be 74, measurable element will be 362, and you have checklist called 18 checklist. Now this checklist will measure all these elements and try to give a score. And if the score is as per the standard, this district hospital will be NQAS certified. If not, it is not an NQAS certified. Right? So you must have heard Kaya Kalp, Lakshya program, NQAS. Now national quality, every facility is now being tried to assess on NQAS, and it is important. If you abide by that, the quality will definitely improve. It's a huge exhaustive checklist, so we are not going to discuss those exhaustive checklists, but you should know that facility now should follow the NQAS standards, National Quality Assurance Standard, right? Okay, let's take the next question. Community level maternal death reporting. Community level maternal death reporting is an important component of Suman program, JSSK, JSY, Pradhan Mantri Matritva Vandana Yojana. Try this. Community level maternal death reporting is important component of Suman, JSSK, JSY, Pradhan Mantri Matritva Vandana Yojana. Try this. Prashant, Lohit, Krish, Mahesh, Shreya. Community level maternal death reporting. Yugandhar goes with C, JSY, D, Manju, Shreya goes, Mahesh goes with A. Very good. Now, let's see the program. JSY, Janni Suraksha Yojana. You know what is what is the main component of JSY? JSY is basically you are promoting institutional delivery. You are promoting institutional delivery, and for that you are giving incentive both to the beneficiary and the ASHA worker. Let's come to JSSK. JSSK is Janni Shishu Suraksha Karyakram. So here you are trying to ensure that the pregnant lady during delivery, she reaches to the hospital, the institutional delivery happens, and the stay in the hospital, any expenditure which is happening for the treatment for the delivery is taken care by the government. So she from home to the hospital, she is brought by the ambulance. Delivery happens. If there is a referral required, the referral will also happen. All the food component will be also taken care. And once the delivery happens, the mother and the child is sent back to the home. Not a single penny is involved. They don't have to spend money. So that is JSSK. Pradhan Mantri Matritva Vandana Yojana is basically we are here you're giving rupees 5,000 for the first delivery, first issue in installment. Now this Suman says, you know what is the full form of Suman? Suman is Surakshit Matritva Aswasan. So you are trying to ensure, give a guarantee of zero preventable maternal deaths. So in this Suman, so you have many activities, almost 18 activities. Majority of you know, good for ANC should be there, high risk pregnancy should be identified, institutional deliveries. So all those things are there. So the main concept is Surakshit Matritva Aswasan, which is zero preventable maternal and newborn deaths. But in this, what do you expect? So it is an integration of existing initiative first of all, like JSSK, Pradhan Mantri Surakshit Matritva Abhiyan. This is on 9th of every month, which the doctor sees the pregnant lady. Laksh is labor room quality improvement initiative and first referral unit. So you are integrating all the programs. Zero tolerance, respect for women's autonomy, dignity, 100% maternal death reporting. So if any maternal deaths happen, that has to be reported and reviewed. And community level maternal death reporting is also there. So if there is a maternal death, there should be a reporting from the community also, so that you can inquire why there has been death, what was the reason, was that preventable, was that not preventable. Because students see, India's maternal mortality ratio is 113. National Health Policy target, if you remember, it is 100. And SDG target just now we have read is 70. So we have reached to 113. As per national target 100 and SDG is 70. So how do you, already different programs are there. So how do you ensure that we reach to 170? So you have to take tough measures. You have to think that let's avoid all preventable maternal deaths. And how do you do that? Unless and until you don't know why there has been death, what was the reason, then you cannot plug those loopholes. So community level maternal has been done, right? Okay. Now let's take amendment in MTP Bill 2020 is, try this. Amendment in MTP Bill 2020 is, what is the new amendment which is there in MTP? Increase the limit of pregnancy termination from 20 weeks to 24 weeks, to expand access of women for safe and legal abortion services, or 20 weeks to 22, 20 weeks to 23, 20 weeks to 26 weeks. Yes, Mahesh goes with A, Parag goes with A, Manju goes with A, Sai goes with A. Yes, now the recent amendment which has been done in 2020 as far as MTP is concerned, from 20 weeks to 24 weeks. So please remember, there is an increase the limit of pregnancy termination from 20 weeks to 24 weeks, right? Okay. Now let's take goal of SANS initiative is. What is the goal of SANS initiative? There is another program called SANS. What is this SANS? Try this. Reducing mortality due to childhood pneumonia in India less than 3 per 1000 live birth, 5 per 1000 live birth, 2 per 1000 live birth, none. Mukesh goes with A. Anyone else? Mahesh A. Yes. What is SANS? Mahesh, Mukesh, Shreya, Rohit, anyone? What is this SANS, Parag? What is this SANS program? What do you know about this SANS? Okay, SANS is basically, let's try to understand. Social awareness. Now that is breath, right, Prashant? But it has got certain full form. Social awareness and action plan to neutralize pneumonia. Please remember, social awareness and action plan to neutralize pneumonia. So it is talking about pneumonia. So there is also a program called Global Strategy, Global Action Plan to prevent and control pneumonia and diarrhea. No? So there also, as far as pneumonia is concerned, we want to reduce the death due to childhood pneumonia to less than 3 by 2025. So the SANS initiative started in 2019. I'll just show you this program, this picture, so it helps you to remember. SANS 2019. You see, social awareness and action plan to neutralize pneumonia successfully. So you see this is the way it has written SANS. So you see the two A's like lungs, no? So pneumonia nahi to bachpan sahi. So this is SANS. So it has got a full form also. Social awareness and action plan to neutralize pneumonia successfully. Right? Very good. So it makes, when you see this IEC material developed by Government of India, it helps us to remember it, right? Very good. Okay. How many home visits of ASHA is planned in HBYC? Is it 3? Is it 4? Is it 5? Is it 6? Try this. How many home visits of ASHA is planned in HBYC? Is it 3? Is it 4? Is it 5? Is it 6? Mukesh, Neha, Mahesh. Mahesh goes with C. Rohit goes with D. Sandeep goes with C. Very good. Uganda goes with 6. No. And Shreya goes with C. Yeah. So HBYC. First of all, what is this HBYC? Mukesh goes with B. No, Mukesh, it is wrong. It's not 4. It's not 6. It's not 4. It is 5. So you have to understand what is HBYC. So there are two things, students. HBNC, you all know this, and this is HBYC. Try to understand. It's very easy. What is HBNC? Home-based newborn care. What is HBYC? Home-based care of young child. Home-based care of young child. Now you imagine, just take an example. There is a birth, right? Let's take home delivery. I'm just giving an example of home delivery. Now when there is home delivery, so what happens? So on the day of delivery, means first day, there should be a visit by ASHA. Then 3rd, 7th, 14th, 21, 28, and 42. Now if you see 1, 2, 3, 4, 5, 6, 7. So 7 visits has to be done under the program called HBNC if there is an institutional delivery. Sorry, if there is a home delivery. If there is home delivery. If there is institutional delivery, then this 7 comes down to 6. Right? If there is institutional delivery, the visit comes down to 6. Right? So this is still 42 days. So this will take care of neonatal mortality. Think in that way, students. Neonatal mortality of India is 23 now. So if 5, 7, 6 visits are being made to ensure that can we reduce this neonatal mortality rate. But after this also, now the government is envisaging Can we make visits on 3rd month, 6th month, 9th month, 12th month and 15th month? So when additional 5 visits you are making, so you are trying to push. What will you do in this age group? Third month, 6th month, 9th month. Definitely you will be trying to take care of breastfeeding, immunization, complementary feeding, nutritional component. So all this will also take care of post neonatal mortality rate, which is 9. So if you add this to, it becomes 32. So 32 is the infant mortality rate of India, students. Now, this is the current data. So if you add both the visits, it becomes 7 plus 5, 12 or 6 plus 5, 11. So if you add both the program, HBNC and HBYC, is this not HBNC and HBYC is focusing on first 2 years of life? And if you add first 2 years of life, students, 365 days plus 365 days becomes 730 days total. 730 days, and add the pregnancy component, which is 270 days. If you add all those, it becomes 1000 day. And you must have heard 1000-day model. No? Let's focus on 1000 day. What is this 1000 day? The whole pregnancy period where you focus on ANCs, immunization, iron folic acid consumption. So that's 270 days. First year 365 days, second year 365 days. You add those, it becomes 1000. So 1000 days. If we start focusing, if we strengthen the quality under this 1000 day, will reduce maternal deaths, will reduce newborn deaths, will reduce infant deaths. So that will serve the purpose. Now, logical, very logical. The program, if you link it, it becomes very easy. Okay. Yeah. Now, take the next question. Involvement of families of sick and preterm newborn as partners in caregiving and decision making in the newborn care facility is called as. What do you call this? Family participatory care, family involvement care, family responsibility care, none. Yes, Mahesh goes with A. Anyone else? Sorry, Prasad goes with B. Lohit goes with, yes, A. Yes. Nowadays, there is also a concept of family participatory care. Now, whenever a sick newborn is admitted, so the hospital, the doctors and the paramedics, and you know what happens whenever a sick newborn, the child is very sick, the family gets very nervous, the anxiety is very high. So what what the program says, let's involve the family also. So but involve the family means family will not do any treatment, but their participation will definitely help us to reduce the stress of the family, and they will also acknowledge the effort done by the doctors and the paramedics. So this is also a component which is now gaining momentum, family participatory care, where the health facility, the doctors and paramedics are involving family members if they are interested, so that they can take care of the child and they can also monitor the child, and accordingly the treatment can be done by the hospital, right? Okay. Now let's take the next question. National Nutrition Mission target of reduction of stunting is Mission 25 by 2022, Mission 30 by 2030, Mission 20 by 2020. Yeah. So how they are doing, it's very easy. What they do, suppose a newborn is sick, admitted in a sick newborn care unit, SNCU. Now the mother or the father, generally the mother, is allowed to stay with stay along with the child. Now suppose the child is in a capacity to take oral, so the mother can, under the guidance of the doctor and the paramedics, can feed the child, can sit together. Anything which is, the nurse and the doctor cannot be there every time. So anything, if they monitor the child, If anything happens, they can call the doctor and paramedics. So in a sense, what is the thought? Because even if you do the best treatment inside the hospital and something goes wrong, students, what happen outside, the family members will start cursing you. So that involvement of family also helps the acknowledgement of work done by you, by means the hospital and the doctors, and it also helps, it gives an emotional bonding, it helps the child also to recover. Okay. Yeah. So in HBYC, Prasan, from third month, HBNC is still 42 days. And from third month is the first, sixth, second, ninth, third, 12th, fourth, and 15th month is fifth. Right? Okay. So this is National Nutrition Mission, Mission 25 by 2022. So what is this Mission 25 by 2022? So students, first of all, National Nutrition Mission has changed to Poshan Abhiyan. Okay, it has changed to Poshan Abhiyan. Now students, Poshan Abhiyan, please remember two things only, the entire things becomes easy. Let me separate into anemia and others. Others means nutritional, malnutrition, stunting, wasting, low birth weight, whatever you talk. But I am telling you anemia and others. Okay. Now, anemia, the target will be 3% per annum. Okay. And others, whatever is there, it is 2%. It will be very easy. You don't have to, if they are asking you stunting, 2%. Now 2% per annum. Now how do you remember this 25? What is and what is the baseline target? Baseline target is NFHS 4. NFHS 4 data. If you go by NFHS 4 data, students, the stunting is roughly around 38 point some percent. So from 38, if you want to come and by 2022, so it is almost 6 years. So you are reducing 12%. So you will come around roughly around 25. So 2% per annum. So it will come to 25. Stunting or any other thing. If you take low birth weight, if you take underweight, all will be 2% per annum reduction. Now come to anemia. NFHS 4 data. NFHS 4 data says all age group where the prevalence of anemia is 50% or more, except boys in the age group of 15 to 19 years. So we don't have to remember the value. We can say blindly that prevalence of anemia as per NFHS 4 data is more than 50% except boys 15 to 19 years. And what is the target? 3% per annum. So in 6 years we will be reducing 18%. In whichever age group, whichever beneficiary you see, 3% per annum, 6 years it will be 18%. That makes your Poshan Abhiyan very easy. You don't have to remember anything else. Okay? And you don't have, and this also helps you to remember intensified iron plus initiative component, anemia Mukh Bharat, which is also called. So that also is linked to this. Okay? Yeah, this I have already said. Poshan Abhiyan has renamed. I will not take this question. I will just tell you it's National Nutrition Mission. It has replaced now. Please also see one thing. POSHAN, right? PM's overarching scheme for holistic nourishment. Have you ever thought in this way? Poshan. POSHAN. PM's overarching scheme for holistic nourishment. So this is also the way you have to see Poshan Abhiyan. It's written here, PM's overarching scheme for holistic nourishment. So this is also a abbreviation. Poshan is an abbreviation you can think. Okay. And I have said already, Mission 25 by 2022. Stunting is 38.4. So we want to reduce to 25%. And I said, except anemia, everything is 2%, 2%. Anemia will be only 3%, right? Okay. Let's take the last question. Rashtriya Poshan Ma observed in which month? Try this. Rashtriya Poshan Ma is observed in which month? July, August, September, November. Yeah, very good, Neha. No, it's not B. Poshan, nutritional month, is in the month of September, students. No, Lohit, it is in the month of September. In India, Rashtriya Poshan Ma is observed in the month of September. Yes, Shreya, absolutely right. So let's go with C, September. Okay. Let's take the last question. All are targeted in NTB strategy except. All are targeted in NTB strategy except. What is not a component of NTB strategy? Right? 95% reduction in death due to TB, 90% reduction in incidence of TB. Zero percent TB affected families, 0% HIV TB co-infection rate. Yes, Mahesh goes with B. So NTB strategy, this is correct, this is correct, this is also correct. This is not correct. 0% HIV TB co-infection rate. This is not mentioned in the NTB strategy component. So the answer goes to D. No, it's D. A, B, C is correct, students. Just see, whenever students always, whenever there is a strategy, it is related to TB, malaria, anything. Whenever there is a strategy, so TB is a disease. When disease, the first indicator will be mortality, always think in that way. Or TB strategy, so definitely it will be working on mortality and morbidity. So first is mortality, so then these are the numbers. These are only the numbers in the targets, 35, 75, 90, 95%. Second come incidence. Incidence means morbidity, new cases. So 20%, 50%, 80%, 90%, these are the numbers. So when you're talking about TB strategy, so obviously you want to reduce the mortality and morbidity. And then comes the third component, that catastrophic cost, out-of-pocket expenditure, money. It should be 0, 0, 0 and 0. And last, 90 is to 90 target, which is primarily used for HIV AIDS, but it is also, it's a catchy thing, nothing very it's a catchy thing, so that it helps us to remember. Reach at least 90% of all people with TB. Reach 90% of key population, vulnerable population, and achieve like 90% treatment success. Right? So this is just catchy thing. If I ask you what is the national health policy target for family planning, universal access to family planning, you say 90%. Full immunization, 90%. Right? So ANC, 90%. So we cannot put it 100. So the next best target always looks like 90%. So this 90, 90, 90 component is used frequently at multiple places. Okay. So I'll stop here. I hope there were a few questions, there were new ones which will help you to revise it, to remember it. There is a possibility that such questions can be asked students. Thank you for joining. Take care, students. Bye-bye.